just a confirmation that people can hear.
Lou, can you hear? Lou, can you hear? What was that? Okay, Kelly, can you test?
Sure. So.
Okay. Yes, we can hear. Okay.
Okay. All right. Very great. So I'm going to go ahead and get started. So I'm Kelly Langel, and I'm the director of the Masters in Public Health, Masters of Science in Behavioral Health degree program at the University of San Francisco. And I'm going to share maybe for about 20-25 minutes about our dual degree program, and then there will be a chance to ask questions. And hopefully that'll give everybody a pretty good overview of the program as well as an opportunity to get some of those questions answered. So without further ado, Mona, if you can please go to the next slide. Now, the University of San Francisco, we have a long history of providing exceptional education. We're the oldest university in San Francisco and the second oldest college in California. USF has 5 different schools: management, law, liberal arts, education, and the School of Nursing and Health Professions. We have over 10,000 undergraduate and graduate students, and we offer more than 100 degree programs. The main USF campus is located in the center of San Francisco near Golden Gate Park, but we also hold our classes at the Presidio campus in San Francisco, as well as in various branch campuses around the state, as well as we do run online classes. Next slide, please. USF is a mission-driven Jesuit school. What that means is that for centuries, Jesuits have advanced academic excellence in the service of humankind. So there's a focus on educating students of all cultures, beliefs, and capabilities, and inspiring them to strive for justice. So for health professions, being mission-driven means that we train health professionals to be excellent practitioners and also skilled professionals within the context of certain fundamental values. Throughout our curriculum, we challenge students to consider issues of diversity as well as social inequities, and we also provide training so that our graduates have the leadership and critical thinking skills to drive change. All the programs within the School of Nursing and Health Professions are committed to preparing health professionals to promote equity and who will positively influence healthcare quality, delivery, and access. Next slide, please. The dual degree program is part of the School of Nursing and Health Professions. So in the School of Nursing and Health Professions, there are about 1,100 undergraduates and more than 400 graduate students. And these students study in San Francisco, they study online, and they study at our branch campuses in Northern and Southern California. So there's a number of different graduate school options offered within the School of Nursing and Health Professions. And here you can see the Master of Public Health and the Masters of Science in Behavioral Health, as well as the dual degree program. But within the School of Nursing and Health Professions, we also offer the Doctor of Psychology in Clinical Psychology, a Master's of Science in Healthcare Informatics. And then on the nursing side, we offer a Master's of Science in Healthcare Simulation, a Bachelor of Science in Nursing, a Master's of Science in Nursing, and then a Doctor of Nursing Practice, where we train advanced practice nurses in family nurse practitioner, healthcare systems leadership, and psychiatric nurse practitioners. So being part of the dynamic School of Nursing and Health Professions, it really gives us the opportunity to tap into the highest quality faculty and create a real interdisciplinary and interprofessional training program. So our faculty have degrees and expertise in social work, public health, nursing, business, informatics, psychology, law, among a lot of other disciplines. Next slide, please. What is public health? So there's a number of different ways that you can define public health, and they all have an emphasis on science and population. So the Institute of Medicine defines public health as what we as a society do collectively to ensure the conditions in which people can be healthy. The World Health Organization defines public health as all organized measures to prevent disease, promote health, and prolong life among the population as a whole. And then the U.S. Centers for Disease Control define public health as the science of protecting and improving the health of families and communities through promotion of healthy lifestyles, research for disease and injury prevention, and detection and control of infectious diseases. So what all of these definitions from our leading public health agencies in the United States and globally, they all focus on populations and assuring the health of populations and using science to assure the health of populations. Next slide, please. Just briefly, the Masters in Public Health, or the MPH at University of San Francisco, it equips students to have core knowledge across public health disciplines, including epidemiology, biostatistics, environmental and occupational health, health policy, health program planning, and social and behavioral health. In our MPH program at USF, there's 3 program options. Typically, students will complete the MPH over 2 years. There's a generalist program in San Francisco. There's a concentration in policy, leadership, and research based in our Sacramento campus. And then there's also an online program that's asynchronous. It means that there are not scheduled times when you have to be online. For the MPH program, it's typically 2 classes per semester. We teach in a hybrid format, which means that we alternate an online week with an on-site class. So every other week you're on campus for a class, and the alternating weeks you're online. The MPH requires 45 credits total. This includes 8 core courses, 4 elective classes, 300 hours of fieldwork, and a culminating capstone paper or master's thesis. The MPH is a wonderful degree. It's one of my favorite degrees because it trains you to be a generalist, where you can apply the skills that you learn from the Masters in Public Health program to any topic out there in health and development and so many other fields. Next slide, please. Now let's turn to behavioral health. What is behavioral health? So SAMHSA, the Substance Abuse and Mental Health Services Association in the U.S., defines behavioral health as a state of mental and emotional well-being and choices and actions that affect health. The Agency for Healthcare Research and Quality Assurance defines behavioral health as mental health and substance abuse conditions, health behaviors, including their contribution to chronic medical illnesses, life stressors and crises, stress-related physical symptoms, and ineffective patterns of healthcare utilization. The Maine Health Access Organization defines behavioral health as the connection between our bodies and the health and well-being of the body, mind, and spirit. So what these definitions of behavioral health have in common is that they're more holistic, and they typically focus on the intersection between physical health and behavioral health and mental health. Next slide, please. In the MSBH program, the Master's of Science in Behavioral program, we see individuals as parts of systems in which each component influences the others. We recognize that achieving better health overall requires attending to not only mental health conditions or physical health conditions, but also to the factors that impact healthcare access and social factors such as housing and education. In our program, behavioral health involves analyzing and understanding how human behavior is influenced by both physical and mental health, and how human behavior can improve our mental and physical well-being. So in terms of program logistics, the MSBH is typically completed in 1 year. They are also evening classes just like the MPH program, and students are typically on campus at the Presidio 2 nights per week. The classes, just like the MPH program, are offered in this hybrid format that alternate weeks between online activities and being in person on site on the USF campus. Most of the MSBH classes right now are offered at our Presidio campus, although it looks like in the future we're actually going to be doing more classes on the main campus of USF. A total of 34 credits are needed to complete the Master's of Science in Behavioral Health. That's about 10 classes. It also requires 300 hours of fieldwork and a capstone paper or master's thesis, similar to the MPH. So in addition to courses designed specifically for the MSBH program, MSBH students will take courses in clinical psychology, healthcare informatics, leadership and collaboration, and public health. Next slide, please. Now, I just wanted to give you all a quick overview of the individual MPH program and the individual MSBH program. And now I want to talk about, for the rest of the webinar, the MPH-MSBH dual degree program. So The dual degree program is designed for students who want to obtain an MPH and gain those skills and expertise in population and community health, but who also desire additional knowledge and skills to address behavioral and mental health issues that will gain from the Master's of Science in Behavioral Health program. The dual degree program is appropriate for students who are committed to eliminating health disparities and working with vulnerable populations, as well as creating social and physical environments that promote health for all. The dual degree provides a broad, in-depth knowledge base and toolkit for the student who wants to design, implement, and lead evidence-based and interprofessional healthcare and community programs. And in all of our classes, we emphasize practice-oriented and applied skills and competencies. Now, importantly, on completing the dual degree program, you actually have 2 degrees. You have both the MPH and the MSBH. And so when you complete the dual degree program and you go to put those little letters after your last name, you get to say, comma, MPH, comma, MSBH. Next slide, please. Now, why do students enroll in the MPH-MSBH dual degree program? So I just want to share from 2 students, first Valerie, and I'm going to read to you what she said about why the dual degree program was attractive to her. The focus on individual level health and social, physical, and psychological factors impacts health and well-being was a great fit with my interests. I feel the core content from public health courses such as epidemiology, biostatistics, and global health policy, combined with the skills that I will develop in MSBH classes such as applied research methods and communicating for healthy behavior and social change, will make me an excellent health leader. I plan to work at the community level, but having a background in epidemiology and biostatistics will provide me with tools that will set me apart. And let me share from Joyce, who's also a current dual degree student. I've always understood that before I can become an agent of change, I need to understand the range of behaviors and motivating factors that contribute to why people do the things they do. I also must be able to review and evaluate policies pertaining to the populations I care so deeply about. Through the dual degree, I will develop the competencies I need to give others the opportunity and universal right to health and well-being that I righteously believe in. So just from these few students, you can see that that combination of coursework gained from a public health focus as well as from a behavioral health focus is pretty powerful, and also that one of the things that sets our dual degree students apart is that they also really want to work at the community level, and they really believe in using health for social change. Next slide, please. Now, in terms of logistics for the dual degree program, you will complete requirements for both the Masters of Public Health and the Masters of Science in Behavioral Health. So it requires about 60 credits for completion for a new cohort that begins in the fall of this year of 2017. So the MPH separately requires 45 credits, and the MSBH separately requires 34 credits. So by enrolling in the dual degree program, you save about 20 credits. So it really saves you money, and it saves you time over attaining these degrees separately. Now, the usual path for completing the joint degree, the dual degree, requires 6 semesters. So you would start in the fall of this year, 2017, and you would continue with your second year in the fall of 2018 and finish in August of 2019. Some students will choose to push out their dual degree program by 1 or 2 semesters, and we're quite flexible and happy to support adjustments to the course pattern as needed if you want to take a little bit more than 6 semesters or 2 years to complete the dual degree program. Now, courses can be taken in a hybrid format. So again, that means that combination of on-campus class time and online course weights. Courses can also be taken in the combined hybrid class and online format. So some of your classes could be taken in that hybrid format that require you to come to campus sometimes, and you can take other classes in a fully online format. Now, what's important to note is that all of the behavioral health classes have to be completed in the hybrid format at the Presidio campus or at the main USF campus if that's where they're offered. So what that means for you as an interested student in the dual degree program is that if you are outside of the Bay Area and you do not have the ability to come to San Francisco on a weekly or bi-weekly basis, then the dual degree program is not the right program for you. You have to be able to come to San Francisco between 1 to 2 nights a week, depending on the semester and your course pattern for that semester, right? And so what it also means is that you're expected to be on the USF campus. For the dual degree program, it works out to between being on the campus 1 and 2 evenings each week. Now, a quick note on that, all of our classes for the dual degree program are offered in the evenings, and most of them will begin at 5, and then depending on the number of credits of the class, they'll go until 7 o'clock, 8 o'clock, or 9 o'clock. So the program is really designed for working professionals, and the large majority of students are working at least part-time while they're enrolled in the dual degree program. We don't recommend working full-time while you're completing the dual degree. We find that it's very stressful for students and you're really not able to maximize your learning in your classwork and in the program. But certainly closer to part-time work is absolutely feasible, and it's recommended so that you're able to maintain that aspect of your life and financial health. Next slide, please. Now, the MPH-MSBH dual degree program Fieldwork. So in the dual degree program, you are required to complete a 1 300-hour fieldwork internship in a public or behavioral health agency. And while you're completing that internship, you'll complete 2 semesters of a fieldwork class so that you'll have coaching from your faculty and your peers around your fieldwork experience and how all that is going. And then your fieldwork culminates in a professional quality capstone paper or master's thesis, as well as a presentation that students conduct in August as part of our Health Professions Day. Your fieldwork experience should have an emphasis on data within the behavioral health field. There are a number of different placement opportunities for your fieldwork, a number of different ways to meet that fieldwork requirement that are really exciting. I encourage all of you to get on the website and look at the MPH and MSBH programs, and over to the right on those main program websites you will see a fieldwork tab, and look at examples of fieldwork for those students. During your fieldwork, you work closely with faculty to identify potential sites, and we prioritize matching you, the student, to an agency based on your experience, your interest, and your career goals. We spend a lot of time talking about the fieldwork in experience in the first year, as well as, of course, in the second year as you're setting up your placement, and then you're actually in your fieldwork placement. Next slide, please. Now, in terms of the course topics, there's kind of 7 main areas. So the first is health leadership and interprofessional collaboration. So dual degree students are required to take 3 classes in this area. These classes include public health administration and leadership. They include interprofessional collaboration, and then either a health policy class or an ethics and behavioral health class, or perhaps both for some students. The second area that we focus on in our courses is behavioral and public health care delivery and systems. So these classes include extensive training in health education as well as health coaching. They include classes such as chronic conditions, integrating mental health into primary care services, foundations in behavioral health, skills in behavioral health, classes such as those. The third area that you'll focus on in your dual degree coursework is intervention development and program management. These include classes in communicating for healthy behavior and social change, project management and quality improvement, and program planning, management, and evaluation. The fourth area that you'll focus on is research and evaluation. So you're required to take classes in biostatistics, epidemiology, and applied research methods. And one note on your research and evaluation coursework, because of the way the dual degree program is set up, you will actually, when you complete your dual degree, you're actually going to have a stronger basis and more skills in research methods than if you did the MPH alone or the MSBH alone. The fifth area of your coursework is environmental health and health informatics, and so you'll take classes in both of those areas. And then you have 4 elective classes that you get to take. Electives are wonderful, wonderful classes. Currently, our electives include things such as global health, health policy, health economics, adolescent health, sexual health and public health practice, community-based participatory research, food and agriculture, among a number of different elective options. And then finally, the last area is your fieldwork and your culminating capstone document that needs to have a substantial focus on using data to inform a particular issue in the behavioral health field. So that was just to give you a flavor of what your classes are going to look like. Next slide, please. Now, for the new dual degree, the new cohort that is has already applied or is currently applying for the April 1 deadline, you'll begin in the fall of 2017, and note that you have to begin in fall of 2017. We only admit students 1 time per year, and they all begin in the fall together. And we find that works really nicely with the cohort model, where all of our students are in the same cohort, get to know each other really well, and that's very important for your success and happiness in the program, as well as beginning your network with other public and behavioral health professionals in San Francisco. So you would plan for 6 semesters of coursework over 2 years total, but again, the program can be completed in 7 to 8 semesters if that works better for you. We can also adjust that course sequence on an individual basis, although that has to be done with permission of the program advisor. It takes about 60 credits for completion, and your fieldwork is going to be done in the last 2 semesters of the program. So if you apply for entry this fall for the dual degree program and you're accepted and you choose to enroll, just to give you a flavor of what your fall would look like, you would take 4 classes. This would total 11 credits for the fall. You would take biostatistics. You would take Introduction to Community Health Concepts. You'll take Foundations of Behavioral Health, and you'll take Communicating for Healthy Behavior and Social Change. Note that we do try and structure classes each semester such that ideally there is a behavioral health focus in at least one of your classes and more of a public health focus in at least one of your classes, so that you're having that twin learning throughout your experience in the dual degree program. Next slide, please. Now, I don't know if anyone is on the webinar today who is completing their MPH and is considering adding the MSBH. If you are in that case very quickly, you have to begin also in the fall. That's when you would begin with those MSBH classes. The time to complete the dual degree program will depend on your timing and in the MPH program. If you're graduating with your MPH either in this May or August, then you're going to need 2 to 3 more semesters. You'll have 5 core behavioral health classes that total 15 credits that you'll need to complete. So these are classes: behavioral health and primary care, chronic conditions, behavioral health informatics, project management, quality improvement, and team leadership and interprofessional collaboration. So those classes would need to complete starting this coming fall and spring in 1 year. And then you may also need an additional 2 to 3 credits if you haven't taken research methods yet. But we'll work with you on an individual basis to set up that course pattern. Next slide, please. Now, if you are an MSBH graduate who will graduate this August, and yet you want to add the MPH degree, and we do have students who do both, then the only time you have to be in the same admission cycle, so that we would admit you for the fall. You're going to need an additional 2 to 3 semesters of coursework. You have 8 additional classes or 24 total credits that you have to take for the MPH. This includes biostats, at the environmental and occupational health, public health system leadership and administration, as well as for MPH electives. And again, we'll work with you to adjust your course pattern. You don't need to complete an additional fieldwork or capstone. Next slide, please. Now, in terms of your application, so we had our early admission deadline in December, so perhaps some of you were part of that round, and congratulations if you were accepted. And our next deadline is indeed April 1st, so you need to have everything submitted by April 1st. You have to have a bachelor's degree, so you have to have finished that. Your bachelor's degree can be in any discipline, and one of the richnesses of the dual degree program is that students come from all kinds of disciplines, and so it really yields a very rich, very interdisciplinary, stimulating cohort. For your application, you have to submit 2 letters of recommendation. Ideally, one of these is from a place where you've worked, either as an employee or in a volunteer capacity, and also it'd be great to have a letter from one of your professors in your undergraduate program. Those are, I put those out as suggestions. Those are not the requirements for where those letters have to come from, but those really help us to evaluate you as a whole candidate. You also need to include a professional resume and a statement of your professional goals that includes a short essay. And for the dual degree program, there are 3 questions, 3 prompts that you'll respond to. You need to submit your transcripts from all of your post-secondary, so all of your schools that you went to after high school, so your colleges, associate degrees, whatever it might be. There's an application fee of $55. I apologize, there's a typo here, but for everyone who participates in a webinar, you'll receive a follow-up email from Carolyn Arroyo, and you'll be able to waive that application fee. So pay attention to that in your email. You do not need to take the GRE. So we take a really comprehensive approach when we're reviewing applications for the dual degree program. We're most interested in really 3 main things. First of all, we want to learn about your work and your volunteer experience that's related to public and/or behavioral health. So this really helps us to see your commitment to the field and that you've worked with the type of populations that we really focus on in the dual degree program. Second of all, we want to be confident that you're going to succeed in the program. So we do look at your previous coursework, although if you have a fair or mediocre GPA, that absolutely will not rule you out. It's part of the whole package of how we evaluate every applicant for the program. And then third, and perhaps most importantly, we assess whether the dual degree programmings are going to meet the professional goals that you outline in your essay. And that's really, that's one of the fundamental elements that we consider in our evaluation of candidates. We want to really make sure that the dual degree program is going to meet your needs, that you come into the program with certain goals, and you're confident that those goals will be met in the program, and we also want to be confident that we can meet your professional goals in the program. So as I said, April 1 is when you need to get your materials submitted, and I think that's good on that. And then next slide, please. So hopefully everyone has been able to go to the MPH-MSBH dual degree program website. Here is the link to it. If you look at the School of Nursing and Health Professions at University of San Francisco, there will be a list of programs, and you'll be able to see the dual degree program and click on that link from there. I also encourage you to really look at the MPH and MSBH websites because they're also chock full of information. Oh, sorry, one thing I did want to say about the admissions. When you apply for the dual degree program, you actually apply initially through the MSBH program, and then there will be a drop-down box, and in that drop-down box is where you indicate you're applying for the dual degree program. Okay? Next slide, please. Now, finally, if you have questions about the program content, the course sequence, is it suitable for your professional goals, then please contact me. That's a picture of me. So I'm a professor in the School of Nursing and Health Professions, and I have my PhD in health behavior and health education, and I also have my master's in public health, also in behavioral sciences and health education. So I love directing this program because it's really a great, it's a great fit for myself because of my foci in both public health and behavioral health. I've worked in a lot of different issues around health behavior change and really figuring out how to develop interventions and to conduct research on interventions that are helping people to make healthy choices in their lives. Now, if you have if you have questions about admissions or as you're working on the application, then please contact Tamara White, and you can see her email there. And thank you. Mona, maybe I can turn it over to you to facilitate questions.
Thank you. Hi, everyone. If you have any questions, please feel free to type them in, and I'll read them off as we go. At this time, we don't have any questions. We can wait another minute in case someone wants to type in a question.
Don't be shy. Now's a great time to ask questions, and chances are the questions that you have or a number of other interested students share those same questions.
We have a couple of questions. How do I undock this one? Yeah. Okay. Yeah.
Okay, we have several questions. Okay, I'll start from the top.
Is there any scholarship for you?
Okay, is there any scholarships for internationals living in USA?
You are going to have to direct that question to Tamara White. We offer some scholarships, and so a number of our students do actually receive scholarships. In terms of if you are an international student, your eligibility for those scholarships, I don't know the answer to that question. So please do email Tamara White. That's the next one.
Okay, next question. Yellow ribbon?
So are you asking about veterans benefits? Is that correct?
That's all I'm reading. Yellow ribbon.
So yeah, so we do have some students who are veterans who do apply their veterans benefits to the program. So that's also something that Tamara can help you with. We have an office at USF. I can try and find the link as we're talking, but there is an office for veterans actually at the University of San Francisco, and they can help you in terms of figuring out how you the paperwork that you need to complete and all of that type of documentation. But you absolutely can apply your veterans benefits for the program, and we of course welcome you. It brings a lot of wonderful, diverse perspectives to all of our coursework and our interactions between students and with faculty and everything.
Great. Next question. Is there any specific course requirements?
I assume that's you're asking about what type of courses you need before you apply or in the process of applying. And so there are some requirements. We do want you to have had, I think, some level of statistics and also some type of course in psychology. Mona, do you know if those are the two areas that we want?
That I believe so, sure, yes.
So, and some students will hit those just in the summer. So if you apply for April 1, you can note that you need to meet those requirements and that you're planning to enroll in those classes over the summer if you're accepted. And usually that works out okay. But most students actually, if they still need to take those, will go ahead and try and take them before they're applying or have those classes underway as they're putting in their.
And I'd like to add that if anyone has any questions about specific course requirements or anything specific, they're welcome to email me as well. My email address is mwoo2@usfca.edu. Next question. Came in a little bit late, but wondering if there was any info on the cost of the program.
So the program, like I said, the dual degree program takes about 60 credits to complete, and each credit at University of San Francisco costs around $1,240 about, and that the cost goes up a little bit each year, but it's around that price, about $1,240 per credit.
I think it's gone up a little bit. It's $12.95 per credit. Next question.
Sorry,
Sorry?
let me go back. You see, I put in the links to the USF Veterans Office and the website. If you can share those back out in response to the question.
Which slide was that? Do you recall?
It's not on the slide. I put it in the chat box for you.
Ah,
Do you see that?
yes. How do I share that? Can you just give me a second, please? How do I share? Okay, great. Next question. What types of careers do people with this degree go into?
So my first response to that is to definitely look on the School of Nursing and Health Professions website and look at the on the MSBH and the MPH pages. There are sub-pages on careers, and there you can get a good sense of what people do on completing the individual degree. Now, this is the second year of the dual degree program, and so we have not graduated a cohort yet, so I can't give you specific examples of what students are doing, but I can give you, tell you a little bit about some other students I've worked with who have a behavioral health focus within public health, what types of careers they continue with. So first of all, we do have a number of students who go on to other graduate programs. We have some students who are inspired to get additional master's degrees. We have other students who are inspired to get their doctorates. And sometimes those doctorates are research doctorates. Sometimes they're doctorates and they're practitioner doctorates. So for instance, we have a student who is working to go on to get her doctorate in clinical psychology. We have a student who is doing their doctorate in behavioral health. We have a student doing their doctorate in epidemiology. So first of all, this will set you up well for research. Second of all, we have students who you may continue at your workplace, but what you get from the dual degree is typically you'll get a promotion that usually is accompanied by a salary increase because you have these additional skills. And so you may bring those additional skills in behavioral health perhaps to your public health workforce or your behavioral health workforce. So that's second of all. Third of all, our students are often designing and leading programs in community health and for at-risk, high-risk populations. So that's another area that students will continue on with. There's really so many different careers. Again, it's one of the reasons that I love this dual degree is it really opens up a lot of different ways for you to go, whether you find that you're in your current work situation, maybe you're relatively happy, but you want to perhaps go a slightly different direction, or you really feel like you need additional training and education in order to move more into management and leadership roles. All of this you will get from the dual degree program. So I hope that helps to answer your question a little bit.
Great. Next question. Why is the GRE not needed?
We really, like I said, I told you there's really three elements that that are most important for us when we're evaluating our students. And for our dual degree program, as well as for our MPH and MSBH program, we don't feel like the GRE tells us about your success in the program. We can look at your transcripts and we can look at your essays and your professional goals and look at your work and volunteer experience and your recommendations for people to work with you, and we feel like that really provides us with a much better idea of who you are and what you want out of the program, why you're applying for the program, what you hope to gain, and then that gives us enough information to evaluate whether we think we'll be successful in the program and whether we feel that the program will give you the competencies and skills that you are desiring at this point in your life.
Okay, next question. For the dual degree program, is there 2 capstone projects?
Thank you for asking that question. I realized I was a little unclear. So that's one of the ways that you're able to save time and money in the dual degree program over doing those the MPH and MSBH separately. So you only are required for the dual degree program to complete 1 fieldwork experience. It is a required 300 hours, and then along with that, you also will write a capstone paper master's thesis on that fieldwork experience related to that fieldwork experience. So thank you for asking that question. You're only required to complete 1 fieldwork experience.
Okay. Hi, I'm a graduate in May with a BA. Can I apply for the 2017-18 program?
Absolutely.
Or wait until fall of 2018?
So that's absolutely up to you. If you feel that you're ready, that you know that public and behavioral health is what you're passionate about and what you want to continue on with, then go ahead and apply. Ideally, you've had some or volunteer experience in behavioral health and public health, and that's what's helped to set you on this path to wanting to complete the dual degree program. So on the other hand, if you don't have work experience or volunteer experience in public or behavioral health, then my recommendation to you is that you do wait another year to apply to the dual degree program until you have that under your belt. It's helpful for you. You want to make sure that this is in fact what you want for your next education, for what you're going to spend time and money on next in your education. You want to be certain that the dual degree program is the right program for you. And so working in the field, working in public health, working in behavioral health, it's a good confirmation to yourself that this is in fact what you want. So, but by all means, we have a number of students who actually apply and who we do accept, who are just finished their undergraduate degrees. And typically those students will have had work or volunteer experience in the health professional field already, and are able to really articulate why they're ready for the dual degree program.
Okay, next question. I would wish to undertake the MPH degree only. Do you have an online provision for the MPH?
Yes, we do. We offer the MPH degree in a fully online format, and you do not have to be in the Bay Area in order to complete that MPH online. So if you go to the School of Nursing and Health Professions website at USF and you click on Master of Public Health, you will scroll down. It's the landing page for the MPH is pretty long, but keep scrolling down and you will come to the option that says online MPH program, and then you can get more details on that program from the website.
Great. I have a degree in the MS in clinical counseling. Courses were from Department of Psychology. Can I transfer some credit?
It depends. So by university policy at USF, you are only able to transfer up to 6 to 8 credits for graduate programs. And so what we do is we look at the courses that you've taken, and if we feel that there are any courses that are comparable to the required courses for the dual degree program, then what we ask you to do is we'll give you our objectives for the particular required course and ask you to try and align those and tell us how you've already met those objectives. And so, and it's students, I don't want to say all the time, but commonly actually are able to waive a few credits because they have taken comparable classes. However, what's important is that the classes that you're trying to waive, that if you took them in other schools, that they were done at a higher level, so that they were a higher level courses in your undergraduate program, or perhaps you took them as part of another graduate program. But we definitely will work with you to see if it's feasible, but we do evaluate each student with each class.
Okay, at this time, we'd like to end our session. And thank you very much for joining. For the rest of the questions that we don't have a chance to answer, we can certainly send that out via email. We'll have a collection of it.
Mona, I have that we have another 10 minutes. Do you still want to go ahead and end now?
We can take a few more questions then.
Yes, I think that would be terrific. While we have students online, let's go ahead and give them the opportunity.
Okay. How do most students fund their way through the program?
So that's an excellent question. We know that this is a big financial commitment. So as I said, the large majority of students actually do work, and they work at least part-time. As I said, we don't encourage full-time work. We find that we do have students who work full-time and do the program, but it's stressful, it's hard, and so we much prefer that you work less than full-time. But the large majority of students do actually work, whether they continue with their employment in the Bay Area and perhaps reduce their hours at that same pace, or whether they come to the Bay Area for the dual degree program and then they seek work while they're here. And students do both of those, but by and large, that is how you fund that's one of the main ways you'll fund the dual degree program. You also are eligible for grants and loans, and there's lots of information that you can learn about what's available to you for loans on the website. And then third, like I said, we do give out some scholarships. They're not large, they're a couple of $1,000s perhaps, but those also are available to students and of course help to reduce the cost of the dual degree program.
Next question. If we are not in the Bay Area and are online candidates, then would we focus on MPH only? How would our fieldwork be affected by our location?
So I can't totally answer that question, but so if you're not in the Bay Area, then you are only eligible for USF's MPH online program. In terms of how the fieldwork is completed, you can do fieldwork in your own geographic area, and then we do offer the fieldwork and capstone classes online too. And actually, it's still online. So if you happen to live in Hong Kong, or you happen to live in Denver, or you happen to live in Ottawa, Canada, and you decide that USF's MPH program is right for you, then that fully online option is available to you.
Great. Let's insert one more question in. Will I be denied admission if I have not completed prerequisite classes? I am planning on completing these classes in the spring term.
No, you will not be denied admission. Sometimes we'll do just a conditional admission where we will state that you need to complete your requirements before enrolling in August. But if you are currently enrolled, then I think what we request is that you send us something from the school that you're enrolled in that just documents that you're currently taking those classes. And then a conditional admin that shows that you're able to complete those requirements and pass those classes.
Okay, thank you, Professor Lingle. I think we can end our session. Thank you, everyone, for joining. And we will also be recording the session, so it will be on the website in a few days.
Bye-bye, everybody.